We all may experience obsessive thoughts, but for some, these thoughts can become all-encompassing and can lead to compulsive behavior. Obsessive Compulsive Disorder, or OCD, is a condition that can impact a person's day-to-day life. For example, someone with OCD can be so afraid of getting contaminated by germs that it leads them to excessively washing their hands over and over again. This condition can be managed, though, with proper help, and those with it can go on to live a normal and productive life. On the program today, we'll talk more about the symptoms of OCD, its risk factors, diagnosis, and how best to manage it. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. Obsessive compulsive disorder is a health condition that affects adults and children all over the world. Now, our guests are here today to tell us more about this and how people with OCD can best cope with the disorder. With us is Dr. Joan May Perez Rifarial. She's a psychiatrist from the Veterans Memorial Medical Center. Also with us is Ms. Jessica Espanto, who is a clinical psychologist from In Touch Community Services. OCD, Obsessive Compulsive Disorder. Many of us associate OCD with the desire to be neat as well as tidy, napakalinis at napaka-organized. But the condition is so much more than that. Dr. Joan, could you tell us more about OCD? What exactly is it?
OCD, as mentioned earlier in your introduction, it's a mental health concern, which is quite common. In fact, for a population, the rates can go as high as 2% of the population who may be suffering from this mental health problem. When we say OCD, it is a disorder already. So it's different from what you mentioned, like the ordinary concern about cleanliness and being tidy. When we say disorder, there is that factor already that it may have an impact on one's functionality already. It can affect one's relationships. It can already affect one's performance at work, in school, because of the time spent in doing all of these behaviors, compulsive behaviors, or engaging in these obsessive thoughts.
Now let's go back a little bit on how OCD can impact someone's day-to-day life, because these compulsions, these obsessions really at some point, like what you said, nagiging disorder na siya. Now, Ms. Jessica, can you give us some examples on how OCD can impact one's day-to-day?
So, for example, individuals with OCD might engage in reassurance-seeking behavior, and there's a pull from their partner to give reassurance all the time. And this can put a strain in the relationship of the couple. For example, an individual with OCD might keep on asking if their hands are clean or clean enough, or if they have that obsession on contamination. Another example would be they might keep on asking, or they might keep on checking doors. It can have a pull in their partner to keep on responding to their behaviors, keep on telling them that they're safe, keep on telling them that their hands are clean or their bodies are clean, and that can put a strain in the relationship.
Now, there are ways that those living with OCD can overcome these obsessions and these compulsions, but we'll talk more about those later on the show. For now, though, let's discuss some factors that can make someone more likely to develop this condition. Dr. Joan, when we talk about risk factors or what may be present to make one prone to OCD, could you talk more about this?
Yes, in terms of risk factors, we always look at it from a perspective of biopsychosocial elements affecting or putting a person at risk for the development of OCD symptoms. So biologically, there are studies which have shown that there are parts of the brain which can be overactive for those who are going through symptoms of obsessive compulsive disorder. So there is hyperactivity in some parts of the brain. So even if they don't want it, some parts of the brain fire up involuntarily severely. So that is one. Studies have also shown some problems in terms of neurotransmitters, the secretion of neurotransmitters in the brain, specifically serotonin. That is the neurotransmitter, or in layman, it's the hormone in the brain which is unstable for patients with OCD. And so those are the targets for treatment biologically.
For those parents watching, are there any telltale signs you would pick out from a child? What type of specific behaviors are we talking about here?
These obsessive thoughts are unwanted by a child, by a teenager. And so sometimes these thoughts are about safety, safety of the family. Sometimes the thoughts are about dangers, anything anxiety provoking for a child. So usually it's about safety of a family member. So they keep on asking their moms, I had this thought that someone in the family fell sick. They need that reassurance. So when a child always comes to the parents to ask for reassurance that everything would be fine, that everything is okay. So that can be one example of an obsessive thought that an individual has.
On the other hand, symptoms of OCD compulsions are behaviors that you may feel driven to perform repeatedly, as what was mentioned earlier. No? So, Ms. Jessica, what are some of these symptoms of compulsion naman?
Compulsions are repetitive behaviors or mental acts. Some examples of compulsions when an individual has an obsession on contamination would be washing, showering, and cleaning. When an individual with OCD has an obsession on harm, they might engage in checking behaviors, checking doors, windows, even stoves.
Dr. Joan, when it comes to OCD, are we talking, is it just one size fits all, or meron bang mild, moderate, severe ito?
When we say OCD, there are different levels of severity to it. In fact, in the Diagnostic and Statistical Manual of Mental Disorders, there would be a specifier for the level of distress or the level of insight that an individual has as to the severity of his or her symptoms. So we may assess one as having full insight, good insight. They know that they are going through some irrational thoughts, irrational behaviors, they are aware of it. But for some, the insight may not be as good, so they may not admit it. They may say that, oh, this is something which I don't have control over. But for some, they really believe in their obsessive thoughts and compulsive behaviors, and we label them as having no insight at all. So there can be that variation in terms of their ability to understand what really is going on with their thoughts and behaviors.
For some, external factors might be triggering their obsessive compulsive disorder. When we return, we'll talk more about these triggers. We're your partner in healthcare. You're watching MedTalk Health Talk. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, where caring is our calling. Obsessive compulsive disorder is different for each person, but the OCD cycle usually looks the same once it is triggered. An obsession leads to anxiety, which then leads to compulsions, and this can become disruptive in a person's everyday life. Let's talk about the most disruptive form of OCD according to the National Institute of Mental Health, which are ruminations and intrusive thoughts. Dr. Joan, could you talk more about this?
For some cases of individuals with OCD, it's always, there can be that possibility that it's purely on obsessive thoughts. So there can be no compulsive behaviors associated with the thoughts. And as mentioned, these thoughts can be about aggression, thoughts about harming people. So these thoughts can lead to one feeling that anxiety, that fear that they may in fact hurt someone. They may hurt a loved one, they may hurt a family member. So for some, this can be very distressing because they do not like these thoughts, but these thoughts continue to come in, and thus the ruminative aspect of it.
Now, Dr. Joan, many might be listening to this and think, pareho lang ba ang OCD sa pagiging metikuloso?
It's different because when we say meticuloso, perfectionistic, so perfectionism can be a part of our personality. So we need to make that clear distinction between an obsessive compulsive personality type, which would include that being meticulous, perfectionistic, we want everything to be in order, versus the obsessive compulsive disorder itself, which is again characterized by the presence of those very intrusive, unwanted thoughts which are anxiety provoking, and then we do something to at least reduce the impact, the anxiety brought about by those thoughts.
Now, external factors might be triggering someone's obsessive compulsive disorder. Jessica, could you talk about what are some of the possible triggers?
So some of the things that maintain OCD would be stress, stress that you get from the environment, work stress, school stress, family stress. There's also pandemic-related factors. Okay, so studies suggest that the COVID-19 pandemic has exacerbated OCD symptoms in individuals. Another trigger would be parental factors. So what do I mean by parental factors? In some situations, parents might model excessive washing or excessive checking, or at times they can participate in the checking behavior. So with the intention of reassuring the child, they might participate in checking, for example, the door if it's locked. So unfortunately, even though the parent has well intentions, this can reinforce the compulsions and the obsession.
Now, another common trigger or a possible trigger here is previous trauma. Dr. Joan, could you talk about this? How does a previous trauma, what type of previous trauma could be a risk factor for OCD?
Any form of traumatic life experience can possibly be a risk factor for the development of OCD, specifically trauma related to losses. We know that when we lose someone, and if it's sudden and we are not prepared for it, then it can elicit symptoms of grieving, depression, anxiety. And in fact, this example studies have shown that when we lose someone, when we lose something, be it real or imagined, it can have a profound effect on the risk of having symptoms of OCD. So it would, for example, if we lose someone from a disease, then it can make someone be more at risk to be more mindful of cleanliness. There can be fear of contamination. There can be fear about safety, security of loved ones, of family. And that's why, again, as many as 80% of those individuals who had experienced stressful and traumatic situations may be at risk for the development of OCD symptoms.
Now that we know the symptoms and triggers of obsessive compulsive disorder, if you think you have OCD, especially if you have ruminations and intrusive thoughts, it is very important that you seek professional help. But only a trained medical and psychological professional can determine whether you have this disorder. Now, Dr. Joan, walk us through how OCD is diagnosed.
First, we do a very accurate and very thorough clinical examination in the clinic. We follow the Diagnostic and Statistical Manual of mental disorders. There is a criteria to be followed there in terms of assessing and diagnosing an individual to have OCD. So in the criteria, it says that there should be the presence of obsessions, obsessive thoughts, the ruminative thoughts are there, and or compulsive behaviors as a response or as a way to reduce the impact of the ruminative thoughts. And another criteria which is very important is that these behaviors or the time spent on ruminating on these thoughts is usually more than an hour. So it's time consuming. And because of this element of being time consuming, then it leads to that impact on the distressing impact on one's functionality. Because instead of being able to focus at work, go to work on time, attend classes on time, people with OCD may spend more hours at home to check and recheck, or maybe wash hands before they're able to go out and do the things or errands that they need to do. And we need to make sure that it's not due to another medical problem or another problem which may be triggered by a substance use or abuse.
Now, Miss Jessica, how is OCD naman determined if this is mild, moderate, or severe?
You can evaluate it in terms of how frequent it happens and in terms of the level of interference it has on one's work, school, or home functioning.
There's no cure for OCD today, but there are ways to keep it under control. More on this when we return. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez and welcome back to MedTalk Health Talk. Obsessive Compulsive disorder is a serious mental health condition that affects many children as well as adults. Now, coping with it can be challenging, but the disorder doesn't have to affect a person's quality of life. Dr. Joan, let's talk about management, treatments available for those with OCD.
So first, we have a psychopharmacology, we have medications which can help with us to put the serotonin balance back. As mentioned earlier, there are problems with the secretion of neurotransmitters in the brain. So that's one. We address the levels of serotonin in the brain through medications. Another is behavioral therapy. So we have different therapies, and usually we combine pharmacologic and behavioral therapies. Studies have shown that this would be the perfect combination to achieve better control of the anxiety, better control of the situation, and it gives us the best results in the treatment and recovery of patients with OCD.
Now, Ms. Jessica, could you talk to us about the behavioral side? Let's talk about cognitive behavioral therapy. How does this work?
So there are two main camps, the CBT camp, cognitive behavioral therapy, and also mindfulness and acceptance commitment therapy. Okay, both of these interventions change how one thinks and behaves. For the CBT camp, a person's thinking is changed through cost-benefit analysis or determining if a belief is true or not true. Okay. For the mindfulness and ACT camp, the focus is actually not the content of the thought, but the process. Okay. So they view the individual with OCD as someone experiencing difficulty. Okay, and this is manifested by the obsessions and compulsions.
Now, Dr. Joan, when it comes to people like those, is OCD something that can be managed by oneself? If they learn certain coping mechanisms, is OCD something that people who find that they have some of the symptoms, should they try to manage it themselves?
For some, they have the symptoms persistently, and for some, I've had patients under my care who had these symptoms on an episodic basis because they've learned some coping strategies and techniques on how to handle the symptoms on their own. But of course, we always emphasize that family support is also very important because no one should go through this alone. When an individual admits or is aware that these are really very unwanted, irrational, illogical thoughts and behaviors, then family support also is very important. We need to be allies with the family because they are the ones who are with the individuals 24 hours a day, 7 days a week. So it's important for family members to be empathic, to understand that this is something that is really beyond the control of someone. It's when we feel anxiety symptoms, there is a feeling that we've lost control over the situation. So the family member should be there to reassure, to encourage, and to always just support and to empathize and not be judgmental.
Now, while obsessive compulsive disorder can be overwhelming at times, help is available for those dealing with the condition. So stay focused on your goals, have a good support system, and find a healthy outlet. Now, these are just some tips that can help you live a healthy and happy life. Thank you very much, psychiatrist Dr. Joan Perez Refarial and psychologist Ms. Jessica Espanto, for being with us today. We appreciate your time and your insights. I'm Dr. Freddy Gomez, and we'll see you again next time.